February is the month of love, so we thought we'd take a moment and talk about loving your spine. While modern medicine hasn't found a cure for a broken heart, we do have lots of ways to treat low back pain. In fact, the #1 reason for folks to seek medical care in the United States is a cold or an upper respiratory infection, but the #2 reason is low back pain. So let's take a minute and look at the anatomy of the spine and talk about some of the ways that we can help better manage low back pain. So your spine is curved and it's composed of backbones called vertebral bodies and the sacrum or the tailbone. In between the vertebral bodies is the intervertebral disc, which is like a shock absorber. This disc contains chemicals that are really irritating to the rest of the body when they leak outside of the disc. So a damaged disc can cause pain not only in the back, but also down the leg when it irritates the exiting nerve roots. Behind the disc, if the disc is a shock absorber, behind the disc are facet joints that serve as struts to help the spine bend, twist, and turn. These facet joints are also common pain generators, and if you come to the pain clinic, we can target these joints with injections. Another common cause of back pain, leg pain, is pain from the sacroiliac joint where the hip bone meets the tailbone. When you stop and look at your different treatment alternatives, you've got drugs by mouth, which we offer at the pain management clinic in a controlled, monitored environment. Later in this segment, we'll have one of the members of the Boone Physical Therapy Department come and talk about exercises and even the history of physical therapy. There's also chiropractic treatment, surgery, and then the various injections that we cover at the pain management clinic. I've got Robin Wilson with me today, the guru of spine physical therapy here at Boone, and we're just lucky to have Robin visit with us today and answer some questions and try and help folks understand ways that they can love their spine. So Robin, can you first tell us a little bit about the history of physical therapy, where to get it started?
So the physical therapy profession actually kind of goes back to about 460 BC when Hippocrates and others talked about the utilization of hydrotherapy, massage, and things like that to kind of help cure illnesses and ailments. Then you get into the early 1800s and it was referred to more as gymnastics over in Europe, which kind of more refers to the development of agility and coordination type exercises to cure illnesses. And then you get into the later 1800s and that's when it actually more became a profession. That's when the first physical therapy boards or organizations were developed in Europe. And a lot of times initially it was nurses who were actually doing the physical therapy because they were in the hospitals with the patients that were ill and able to do what they needed to do during their shifts. And it wasn't actually until the early 1900s where it was established as a organization here in the United States, at which point it was mostly hospital-based programs and treatments, and it wasn't until around the 1950s, late 1950s, when we started actually going out into outpatient clinics, rehab centers, and things like that, which was sparked by the number of wounded soldiers coming back from World War II and the polio epidemic.
That's fantastic. So it seems like today there's almost more of a focus on outpatient physical therapy almost than inpatient. Would you agree?
I would agree, especially with the fact that our patients with the advancements of medicine are spending less time in the hospital, then that gives us less time to actually treat them in the hospital, which obviously is going to push our treatments more to the outpatient setting.
So as a pain management specialist, a lot of times I'll see folks with low back pain and I encourage them to do some aerobic activity, but also core strengthening. Why is it important that a patient see a physical therapist for the development of a core strengthening exercise program rather than just go to their local gym or join Pilates or yoga? Can you help us understand that?
So core strengthening and the core muscles are basically the deeper spine muscles, the deeper pelvic muscles in your respiratory diaphragm. And then some others that they sometimes will lump in there also is your hip muscles and then the muscles that anchor your shoulder blade onto your rib cage. And so when you're developing those core muscles, you really want exercises that are specifically targeted to strengthen those muscles, which are primarily stabilization muscles. when you go to a gym and you use the big equipment, those are designed more to strengthen your dynamic or your moving muscles. So it's your larger muscle groups that it's actually exercising. The other thing that's important with the core strengthening is, if a patient is very weak because they've been in pain and they haven't been moving for a while, then it's very easy to compensate with inappropriate muscles. So if they don't have that knowledge and that body awareness to be able to know that they're engaging their core muscles, it's really easy to think you're strengthening those core muscles, but you're really cheating yourself by strengthening other muscles instead.
Sure, and a physical therapist to be able to point that out, whereas
Yes.
me just going at it with a bench press machine, I'm not going to be able to really sense that or even know that I should be doing something different.
Yes, and as though with the yoga and the Pilates, like you mentioned, they are designed to strengthen the core muscles and help work with those, but if you're not in a small class setting, then you're just following the lead of the instructor, and they're not necessarily going to point out that you're doing it improperly because they're looking at a grand scheme of 10 to 20 participants in a class.
Right. So the one-on-one setting with physical therapy is ideal.
Yes, sir.
Well, let's say I send a patient over for a physical therapy visit. Can you describe what that patient's going to experience during their initial visit and maybe some subsequent visits as well?
So in an initial visit, we will take a look at the patient's posture. We'll take a look at the range of motion and strength in their hips and their spine muscles. We'll kind of do some assessment of things like nerve mobility. Is there some kind of a restriction of the nerve being able to move? And then we'll also assess their muscle tone. So are they too tight? They have muscle spasm because of the pain. Do they have low muscle tone because of the pain and their inability to actually activate those muscles? And then in subsequent sessions, we will develop a plan specifically targeted to them. So it will include exercises that would be strengthening, flexibility, and range of motion exercises. We'll work with them on helping them find what a normal posture is. Sometimes if they've had some kind of an injury or a trauma in the past, some of their joints, like their sacroiliac joint or their hips, may be out of alignment, at which point we'll go in and we'll look at those joints and use different techniques to get those joints moving better so that we take that strain off the posture. And then we do a lot of education also with teaching patients how to lift properly, how to prevent further injury to their spine, and just kind of daily activities, kind of little tips for how to do those activities without causing so much strain and pressure on the spine.
That sounds perfect. Do you see a big role for modalities like E-stim or ultrasound in your practice?
Yes. So the E-stim is used for pain reduction. It's kind of like a TENS unit. It helps kind of override the body's pain receptors and kind of get them a little bit of pain relief in that sense. And then sometimes we'll use different heat modalities to kind of help break up the muscle spasm, or cold therapy to kind of help decrease the inflammation in the tissues.
In my practice, sometimes I'll want to sort of pre-treat a patient so that they can better participate in a physical therapy program. And so I'm wondering, from your perspective, have you ever seen a patient who was either prescribed some medication or underwent an injection who prior to that treatment, that intervention, really had hit a barrier, wasn't able to progress in your physical therapy program, and then afterwards really did better? Can you think of any examples like that?
I've had lots of examples of that. We often have patients that will come in after an injection, at which point, they will admit that prior to that injection, they were in too much pain to be able to do any of the things that we were asking them to do. I've also had patients who had been coming to therapy for a while who just kind of hit a wall of not progressing any further, who then went for some kind of other intervention like an injection or oral medications to kind of help reduce that inflammation in their body and kind of help take care of that last little bit of that problem within the spine that physical therapy wasn't able to address.
It's great to see that two teams working together like that.
Yes.
Well, we're back with our fearless volunteer, Corey, and we're going to talk about abdominal strengthening exercises. As it turns out, when these chemicals inside the disc leak out due to a disc herniation or rupture, a torn disc, a bulging disc even, it can cause a lot of pain, not only in the back, but down the leg. So we're commonly telling folks, hey, listen, we're going to send you to physical therapy to develop some core strengthening, strengthen your abdominal muscles.
We're going to kind of talk about a little bit the importance of the core muscles, and like Dr. Noble mentioned, his favorite exercise, the dead bug, and why those muscles developing is so important. So basically, your core muscles give your back and your body the stability to hold your spine and your posture in position. Your larger muscles, your legs and your arms, they work off of your core, or this part of your body. So when you don't have the strength and the stability in your core muscles, then it's kind of like that loose hinge in your door, where if you open that door, it kind of shifts. And so that spine and that core muscle strength is that screw. And when that screw is tight and strong, it keeps that excess shifting out of the spine when you're moving the door. Okay, so I'm going to demonstrate the dead bug, and basically the dead bug is a little bit more of an advanced exercise, so it's not one that you would want to begin with, but for somebody that already has some core strength, it's an excellent exercise because it makes them engage and hold those core muscles, and at the same time move those arms or that door around the hinge. So Corey's going to tighten his stomach muscles. He's going to take both arms up towards the ceiling. Then he's going to bring both knees up. And he's going to keep these core muscles tight and engaged. So he's going to hold his spine still. He's going to use his abdominal muscles to keep his spine from moving. And he's going to move his arms in opposite directions. So he's going to take one arm and leg up overhead, bring it back to the middle, and then he'll take the other arm and leg out, and then bring it back to the middle. And so this whole time, he's tightening those core muscles, making them strong, teaching them how to turn on while he's moving his arms. And that's important because when you're up and doing daily activities, you have to be able to engage those core muscles to hold your body strong so you can do things like walk, lift things, carry things, and be able to move without putting so much stress and strain on your spine. So if you think about your spine muscles being stabilizers, and they're about the size of your pinky finger, versus your arm and leg motions being more of your moving muscles, and they're more about the size of your forearm, especially in the hip, then you can see that it's very important to strengthen those little muscles so that they can have the strength to hold your spine in place. Come on down. So simpler exercises that would be for a beginner would be more holding those core muscles strong and doing something as simple as sliding that leg out and sliding it back in without letting that back move. And you would just kind of repeat that type of activity. Other more advanced exercises would be holding that core still and just utilizing the legs. Starting with just holding the legs and then adding a little heel tap down. But just like we talked about earlier, if you don't have the core strength to begin with, it's very important that you start these exercises with somebody that has knowledge of those core exercises to ensure that you're not using inappropriate muscles and that you are actually engaging those core muscles. Because if you do them improperly, you can cause more strain on your spine. Very good.
Robin, you've been a physical therapist for 20 years. 19 of those years you've spent specializing in spine. Can you think of an example or two where physical therapy has helped a patient live a higher quality life and allowed that patient to achieve their activities of daily living more effectively?
I could come up with a million examples for you. I've had quite a few patients that came to me with just pain that was so excruciating that they couldn't sit, they couldn't walk. Every time they moved, they would have pain shooting down their leg. And not to say that I could cure every patient, but I had a gentleman that worked for a bread delivery company and had strained his back trying to push his cart back into the truck and strained something in his back. He couldn't sit. Every time he put weight on his one leg, he just had severe pain that was disabling. And he came into me. He had some very specific joints in his lower spine and pelvis that weren't moving properly. We got those joints moving better. And within about 2 or 3 sessions, his pain levels were almost down to 0. We spent a couple more sessions working on exercises to help him regain his strength. And he went back to work with no pain. And I actually ran into that gentleman about a year later, just in a parking lot in a local retail store. And he remembered me and I remembered him, and he was just like, I just want to thank you so much for helping me. And I also had another lady recently who started having a lot of pain with running, and same thing, she had some specific joints that weren't moving right, some specific muscle weaknesses that were causing her to compensate and not move properly. And so we worked on getting things moving better, got her flexibility and her strength back, and she's back to running again. And not to say that we can do that with everybody. You know, some of our patients do have some significant degeneration in their spines, either to the discs or to the joints between the individual spine bones. And obviously we can't make those, you know, destructive changes go away, but we still have great success with minimizing their pain, getting them back to some of the activities they love, like dancing, walking, traveling with their spouse in their retirement. And it's great to see the smiles on the patients' faces when they realize that they don't have to live in that constant cycle of pain.
It sounds like you've really made a difference in some folks' lives. That's great.
And I enjoy it. That's what I get my pleasure out of, is seeing them smile and return to their normal daily activities.
Right. Thanks so much. You know, in many ways, prevention is the key. When we talk about trying to prevent back pain from ever starting, what is it from a physical therapist standpoint that you can identify as some of the ways that folks can modify their behavior in their day-to-day living that would help them prevent back pain from ever starting?
Well, and the biggest key to eliminating the back pain is prevention. And that starts when we're very young. Because 9 times out of 10, your back pain isn't started by a one-time significant trauma, like a car accident or something like that. Often our pain is just years and years of little small micro traumas to the muscles, the discs, the joints, that just kind of build up over years and kind of start to cause that degeneration in the spine. So some of the things that people can do when they're young is maintaining good posture. Our bodies were meant to move. So if you are in a sitting position at work all day, like many people are at a desk or a computer, making sure that that posture is appropriate, that the desk and the computer monitor are set up appropriately for your body to use, and then taking frequent rest breaks so that you're getting out of that posture, because sitting posture is a little more strengthful on our bodies than standing, because we were designed to stand and move. When we're standing, thinking about things like putting equal weight through both feet. So a lot of times people will stand kind of on one leg, which shifts their posture and all of their muscle use to that side of their body, kind of makes them bend their spine a little bit and can kind of cause strain of muscle weakness and muscle imbalances over time, because you get muscles on one side of the body that are stronger than muscles on the other side of the body. So just to kind of help keep that balance. Lifting mechanics is very important. I kind of mentioned earlier about, you know, the muscles in your spine being about the size of your pinky finger and the muscles in your hips and your legs being the size of your forearm. And yet so many of people will go and they'll bend at their backs to, you know, get that 50-pound bag of dog food out of the back of the trunk. And those spine muscles weren't designed to do that. We always kind of harp on people about bending from their knees and their hips. It's because you want to use those bigger muscles to move. The other aspect of that is your spine joints are only about the size of your pinky fingers, your fingernail. And so your other joints, your hips and your knees, are about the size of your hand. And so you want to use that bigger joint to produce the motion, because the more you use that motion through those little bitty joints, the faster they wear out. And of course, you have to have the strength and the flexibility to be able to maintain good posture and to be able to utilize those muscles to bend and lift properly. You know, I often hear people talk about how I have bad knees. I can't bend my knees and my hips like that. Well, if you don't stop doing it that way and you continue to bend from the back, then you're going to have bad knees, bad hips, and a bad back. You know, so you're not going to have good joint left. We talk a lot about, you know, just exercise in general, because the body was developed to move, and so the longer it stays stationary, the more likely it is that those muscles will get tight, those joints will get stiff, and you'll start to develop some weakness in those muscles from lack of use. Other things outside of that, you know, that people don't really always think about in relation to back health would be things like weight management. You know, any amount of extra weight we carry, you know, does affect our joints. You know, it's extra weight loaded on our joints. If we have, you know, think about pregnant women when they're carrying towards the end of their term, all that weight pulls them forward, then their back muscles really have to compensate. So even the beer gut type thing can affect things like that. Looking at nutrition, food choices, hydration with water, that affects how healthy your body is on the cellular level and how easily your body can overcome those little micro traumas that build up to cause back pain. Other things would include stopping smoking, you know, because as we smoke, that's taking the nicotine and other chemicals in the cigarette smoke kind of binds to those cells in your bloodstream and reduces the amount of oxygen that's being carried to your cells. So again, it's kind of limiting your body's ability to stay healthy and to repair itself should one of those little micro traumas occur. And so that just kind of perpetuates that decline and that degeneration over time.
Very good. It's like Mama said, right? Eat right, sleep right, and things will go well.
Yes, sir.
So earlier in this segment, when we were visiting with Robin, we talked about how sometimes a patient will hit a barrier in physical therapy and they need some sort of treatment and intervention and injection to push through that barrier and effectively participate in physical therapy. So again, looking at our spine model, what are some of the injections and treatments that we offer at the Boone Hospital Pain Management Clinic? Well, we'll start from the bottom and work our way up. We talked a little about the sacroiliac joint where the hip bone meets the tailbone. We can take folks back if they have inflammation of that joint. It's called a sacroiliitis, and under x-ray we can target that joint with a needle and inject a combination of local anesthetic and steroid to try and help with that pain. And this sacroiliitis can cause pain not only in the low back but also down the legs. Another big cause of leg pain is radiculitis or radiculopathy, when one of these nerves exiting the spine is irritated or pinched. And so we can target these nerves with what's called a transforaminal epidural steroid injection. Again, under x-ray, we target this nerve as it's leaving the spine and inject some medicine to soothe that nerve. Next, the facet joint, we've talked about that, the knuckle joint, the strut, if you will, that helps the spine stay together, not topple over like a stack of children's blocks. We can target the joint itself with medicine to kind of cool things down, or we can block the nerves that innervate the joint and later burn those nerves, and folks can see 6, 12, even 18 months of pain relief following that particular procedure. And then epidural steroid injection, which many people are familiar with as a way to access the fatty space, the epidural space that surrounds the spinal cord. We inject medicine there to, again, soothe the area and help manage the pain. So if those things fail, oftentimes we'll take folks under x-ray and, again, access that epidural space and put a wire in there. You can see two of these wires here, perhaps, and these electrodes stimulate the spine and block the pain. This technology's been around for about 50 years. It's called a spinal cord stimulator. It's like a pacemaker for pain. We've had great success with both back pain, leg pain, neck pain, arm pain, as it relates to the spinal cord stimulator. And sometimes we'll inject medicine directly into the spine, into the spinal fluid, using a pain pump that meters out a specific dose of medicine hour after hour, day after day, and that's called a pain pump. or an intrathecal pump, and we can put medicine like morphine, local anesthetic, or even snail spit, Priol, into that pump and deliver it into the spine. The snail spit or the Priol is called ziconotide, and it's like morphine, but it skips the step that gets people high, and so we find it very useful in managing persistent chronic pain. Well, I hope you enjoyed this segment on loving your spine. As we said before, modern medicine hasn't found a way to cure a broken heart, but the team at the Boone Hospital Pain Management Clinic and Boone Therapy can certainly help with your back pain, so please give us a call.